Connective tissue, we have the one is cell, other one is stroma. The connective tissue cells usually are spindle shaped. And whatever the cells make, that forms the stroma. For example, fibroblast, it will be a collagen. That is the predominant stroma in connective tissue. These spindle cells, there are mainly three you have to understand. One is fibroblast, other one is smooth muscle, and the third one is neural tissue. Okay, these are three spindle shaped cells, and each of them will be spindle shaped. By seeing the nucleus, you can see the difference. In fibroblast, the nuclei will be tapered and each end. This will be the fibroblast. It's tapered. It's really spindle. Spindle means the one which you use in weaving. Smooth muscle, when you take it, it will be blunt on both ends, and we call it sugar shaped. That is smooth muscle. And the neural tissue, it will be having a wavy nucleus. So, by looking at the nucleus, you can see whether it is fibroblast, smooth muscle, or neural. And there are two more cells that will have wavy nucleus. One is ovarian stroma, and then tendon.
Yes, sir.
So, there are three connective tissue cells that will have wavy nucleus. One is neural, other one is ovarian stroma, and the third one is tendon. And these produce the mainly fibroblasts are the predominant in connective tissue, and they produce collagen. And that collagen is acellular eosinophilic. Surrounding that, you see the fibroblasts, and you see the nucleus that are spindled or both sides. What is this cell? Is Veda there? Veda.
Yes, sir.
So, what do you think? What is this cell? I am drawing only the nucleus.
Fibroblast.
Super. This one?
Second is blunt end, so smooth muscle.
Third one?
Third one, neural. It can be ovarian stroma or even tendon.
Super. So, this is very, very important to understand on the HNE level. This is fibroblast. This is smooth muscle cells. And this is neural, ovarian stroma, or tendon. Tendon includes fascia also, fascia and the tendon sheath. They all look alike. These are the three main cells you have to remember. And you know the blood vessels, the neutrophils, eosinophils, what do they think? Will they be in connective tissue? Yes, because what do you call connective tissue? Those cells that are derived from mesenchyme is the connective tissue. You all know ectoderm, endoderm, mesoderm, isn't it? Ectoderm and endoderm, they produce cells, whereas mesoderm produce connective tissue, and the RBCs from the bone marrow, WBCs, they all are part of connective tissue. And in the connective tissue and adipocytes also you have to see them, the yellow color. So, these are adipocytes. Adipocytes, usually they will be of, the adipocyte size and shape will be the same. They will have abundant cytoplasm with full of lipid. But when lipid is there, it is removed during the processing. And usually the nuclei will be very inconspicuous, and usually it is seen in the periphery. They are not seen in the center. You see the abundant clear cytoplasm. There is another concept you have to remember here. Here the clear cytoplasm. So, whenever you see clear cytoplasm, you have to think of three things. It can be lipid, as in adipocyte, can be glycogen, or it can be water. Only these three things will have a clear appearance in the HNE section. in the cytoplasm. Lipid, you can do special stain called Sudan black. And for this, you have to do a frozen section. Imagine you all know what is the processing now, isn't it? When you process the tissue, all the lipid will be dissolved. That's why you are seeing it, because they are not there. There is another interesting point. Some things you see because they are there. Some things you see because they are not there. Lipid is one best example. Gout crystals are best example. Cholesterol crystals are best example. We see them because they are all not there, and they just the empty spaces will be there. So that's one of the concept you have to remember. So lipid you do Sudan black, and glycogen you do PASD, and we don't have any stain for water. This is another concept you have to remember. Clear cytoplasm. Then blood vessels are another main thing in connective tissue. So we have arteries, veins, lymphatics. These are all the three main things. The smaller arteries we call capillaries, and then arterioles. Smaller veins we call venules. And there is no smaller lymphatics. All lymphatics are very small, most of them. So how to differentiate them? So for a blood vessel, you have to see a lumen, and the lumen is lined by endothelial cells. I will black color you will use, and these endothelial cells are flat cells. You can't see them continuously. They are fenestrated, and they will have a centrally placed round nucleus. So this is for blood vessels. If in case of arteries and veins, they will have lot of RBCs, and they will have some WBCs also. Whereas when you compare to the lymphatics, again I will draw a lymphatic. So you have to remember these are fenestrated cells. That's why they allow passage of material inside and outside. On H&E, you cannot differentiate the endothelial cells of arteries, veins, and lymphatics. They all look alike. Whereas instead of RBCs, in the lymphatics, you will have some fluid. It's a lymphatic fluid. You don't see RBCs in the lymphatics. And you see collection of lymphocytes. So this is the lymphatics. So lymphatics, arteries, and venules, they will look like that. And another thing, lymphatics will have lot of valves. You all know imperforated thing, isn't it? The valves will be there. So like that. And veins also can have valves. Only the arteries won't have valves. So if you see a blood vessel with a connective tissue running from the wall into the lumen, they are all the valves. When you see valves, you have to think of artery, veins, and lymphatics. Then how will you differentiate artery and vein? Before that, I should have told you there are three layers in the blood vessels. Okay, one is intima, media, and adventitia. Intima is made up of endothelial cell and some subendothelial tissue. Media is made up of mainly smooth muscle, and adventitia is made up of connective tissue. And depending upon the amount of smooth muscle and elastic fibers, presence of elastic fibers, we can differentiate arteries and veins. This is the basement membrane of the blood vessel, and you have to remember the that also I forget. This is the basement membrane over which the endothelial cells are sitting. These are the muscle bundles. The arteries, as you remember, they are the highly muscularized structures because they have to withhold the pressure, isn't it? So that will have lot of big muscle bundles. And lymphatics won't have any muscle bundles. They are very passive transfer. There is no contraction happening in the lymphatics. So, and the veins are in between. And more than the thickness of the muscle bundles, all arteries will have two elastic lamina. Black one is the elastic lamina, whereas there is only one elastic lamina in the vein. Endothelium wise, you cannot differentiate arteries, veins, and lymphatics. Lymphatics in the lumen, they may have valves and lymphatic fluid, and muscle bundle will be very, very less, probably one layer. Whereas the arteries and veins, major arteries and veins will have lot of muscle, but arteries will have two elastic lamina, internal and external elastic lamina, whereas veins will have only one elastic lamina. We will go to the pictures and then we will see. If there is anything, we will come back.
Composite illustration of loose connective tissue with its predominant cells and fibers. From the top, they have labeled a lymphocyte, macrophage, reticular fibers, neutrophil, collagen bundle with fibers, nerve fiber, capillaries, elastic fibers, mast cells, fat cells, fibroblasts, and then plasma cells and fibrocytes, sir.
3.1 Loose connective tissue spread stained for cells and fibers, high magnification. Number 1 is mast cells, sir. 2 is fibroblast, 3 collagen fibers, 4 plasma cells, 5 elastic fibers, 6 small lymphocytes, 7 capillary with erythrocytes, large lymphocytes, 9 mast cells, 10 elastic fibers, 11 plasma cells, 12 macrophages with ingested particles.
3 cells you have to remember: RBC, WBC, platelets. Each, the hematology diseases are very simple, whether it affects the quality or it affects the quantity. For example, when WBC quantity is less, leukopenia, platelets are less, ITP, RBCs are less, anemia. Quality, how they are functioning, okay? All platelet disorders, von Willebrand's disease and all, that is more about quality of that. The hematological disorders are very easy. Either they are RBC diseases, WBC diseases, or platelet diseases, and each one of them will be qualitative diseases or quantitative diseases. Life is very, very simple. Then how will you classify the, let us see the WBCs, because that's the one. Platelets, you never see it in histology, you see it in all hematology. The platelets are never seen in histology. Probably their mothers, megakaryocytes, can be seen. Let us start. RBCs are developing from erythroblast, isn't it? WBCs are developing from myeloblast, and platelets are coming from megakaryocytes. It is very funny in RBC because the erythroblast will have a big nucleus. But when you come down to RBC, they won't have any nucleus. How the nucleus is removed, we don't know. People are predicting it can be apoptosis, and it happens in the bone marrow and spleen, but exactly how the nuclei disappear, we don't know. For theory purpose, I will tell you the development, but morphology, you ask the hematology people. Erythroblast, and then they will become normoblast, and the normoblast will be 3 types: early, intermediate, and late. So erythroblast to normoblast, early normoblast, intermediate normoblast, late normoblast, and then they will become reticulocytes, and then they become RBCs. Here they are getting more hemoglobin, and the nucleus size will becoming less as they are progressing towards RBCs, and hemoglobin content will be higher. And when you get the hemoglobin higher, they will give you a pink color. So late normoblast will be pink cytoplasm. Early normoblast will have a blue cytoplasm because no hemoglobin. Intermediate is amphophilic, mixture of blue and pink cytoplasm. Coming to the myeloblast, then you have promyelocyte, then myelocyte, and then metamyelocyte, and then stab form, STAB, stab form, and then lastly mature neutrophils and mature. In the neutrophil WBCs, you have to divide them predominantly into granulocytes and non-granulocytes. This whatever I mentioned, promyelocyte, myelocyte, metamyelocyte, stab and mature form, it is for the granulocytes. And in the granulocyte, these granules, some of them love eosin stain, so we call it eosinophils. Some cells will love the basic dye, that is hematoxylin, and that's why they are called basophil. And some are like neutral, okay, so that is known as neutrophil. And in the non-granulocyte, it's mainly lymphocytes and monocyte. The lymphocyte, previously we used to say small and large, but now it is gone. Now the lymphocytes are mainly divided into T and B cells. Whether they are educated in thymus or bursa fabricius equivalent in human body, they think it may be bone marrow or mucosa associated lymphoid tissue. Depending upon where they educate, they get the degrees as a T lymphocyte or B lymphocyte. And monocyte, when they come out of the blood vessel extravascular, then they will have different names, and they are mainly the category is macrophage. Upon the organ, these macrophage get different names. Let us just finish it. What do you call it in liver? Kupffer cells. You have heard of Kupffer cells? Kupffer, Kupffer cells. Macrophage in spleen. Littoral cells. In the brain, they are microglia. In all other tissue, they are known as macrophage. So this is the monocyte macrophage system. This is the theory behind it. And the cell which we have not covered so far is mast cell. So, and the mature B cells will become plasma cells. We'll see the morphology of these cells, which can be seen in the histology aspect, not as in hematology aspect, because hematology aspect you have to go more finer details. One thing regarding RBC, whenever you see RBC, it may be confused with the DD for RBC in histopathology is eosinophilic bodies. And there are a couple of tumors that will have eosinophilic bodies. And how will you differentiate? RBCs will be uniform size, shape, distribution. Whereas the eosinophilic bodies, they will all look like RBCs, but they will be of varying sizes and shapes. And RBCs are predominantly intravascular. It can, in case of hemorrhage, it can be extravascular too, but it is always intravascular and normally not within the cells, not a intracellular RBC, because it itself is a cell. Whereas eosinophilic bodies can be intracellular or extracellular. Mainly they will be of different sizes and shapes. That is about RBC. Coming to WBC, so we will first finish the granulocytes. So neutrophil, so that will be a large cell, and they will have more than 3 lobes, and they are connected with chromatin bars. This is neutrophil, and the granules will be neutral. Usually the lobes are 3. In case of megaloblastic anemia, they may develop more lobes, and they will see more than 5. To my understanding, if you see more than 3% of neutrophils with more than 5 lobes, you have to think of megaloblastic anemia. All these numbers, what I am telling you, also please check it with the textbooks. Then we will go for eosinophil. It will be same size. Usually they will have 2 lobes of the nucleus, and they are usually called as spectacles. There is one other thing, bikini shaped nuclei. That's another thing. And when you see the granules, they will be eosinophilic. And neutrophil and eosinophil, the granules won't go and sit over the nuclei. Don't know why, but you can see the nuclei very well. When you come to the next cell, basophil. Again, it will be of same shape. Usually the nuclei is monolobed. The problem here is you cannot see the nuclei. All the basophilic granules will be sitting over the nuclei also. But they are better appreciated in the peripheral blood rather than histopathology. In histopathology, the eosinophil won't show this much of granules, okay? It will show 2 lobes, and it will be more like a fuzzy eosinophilic cytoplasm. You don't see the granules. And then we are coming to agranulocyte that are divided into lymphocyte and monocyte. Lymphocytes, they will have again smaller than neutrophils, but the cytoplasm will be very, very less. The chromatin is very bluish. So this is the lymphocyte. The white space you see outside, that is the cytoplasm. Cytoplasm, for completion's sake, I will draw the cell border with black color, and the cytoplasm will be very less. This is how lymphocyte will look, and the nucleus is hyperchromatic, full of chromatin. Coming to the monocyte, be slightly larger, and they will have more kidney shaped nucleus, and it may show 1 or 2 micronucleoli. And the macrophages are the cells that like scavenger cells. So the cytoplasm can have a lot of things, nuclear fragments, it can have vacuolations, it may have eosinophilic material. So the cytoplasm of the monocyte varies depending upon what it is having. Can have hemosiderin if it is in the hemorrhagic area. So the cytoplasm varies in monocytes. And platelets, you usually don't see it in the histopathology. And but sometimes you may see megakaryocytes, and mega means large. They are large cells, and the nucleus is multilobated. It is not multiple lobes. Same nucleus is multilobated. Nuclei of the megakaryocytes are multilobulated rather than multiple nuclei. Same nuclei twisted on each other is the megakaryocytes, and you can see some bubbles sitting outside. Cytoplasmic membrane may be irregular, and these are all the platelets, future platelets. Okay, so they will shed off like platelets. They are the cytoplasmic fragments of the megakaryocytes. And plasma cell is one more cell. You can see it very nicely. And remember 3 P's for plasma cell. One is they are plump cells, and 2 they will have peripheral nuclei. Okay, and around the nuclei you can see some hallowness. Okay, so that is known as perinuclear halo. Plump cells peripherally placed nucleus with a peripheral perinuclear halo, and chromatin pattern is very, very important. It will look like clock face or cartwheel. Plump cell, peripheral nuclei, perinuclear halo. Mast cell I have not covered, isn't it? Mast cell, yes, we'll put that also. Mast cell will also again, it's a round cell, and very granular cytoplasm. Nucleus is again only in the center, round to oval nucleus in the center, and it will have very granular cytoplasm. And the color of the granularity is very, very important. It's one of the material that gives a metachromatic character. Meta means what? Remember metaplasia? Meta means different. Here, you stain the mast cell with toluidine blue. Okay, for example. So, toluidine blue, the granules, what color? Toluidine blue, usually.
Blue color, sir.
Blue color. It should take blue color, isn't it? But in toluidine blue, it will take a pink color. So, that's a metachromatic nature. If you stain with a red stain, it will take blue color. Okay. There are certain physics in pathology you have to remember. So, I will write here, like I will put a box. And I don't know them. So, it's very important for you to remember that. One is metachromatic type. What is the physics behind it? Second one is amyloid. Beta pleated appearance, amyloid. The Congo red, they take the apple green birefringence. Why it is taking? Some physics behind it. Third is gout and pseudo gout. Fourth is blue nevus. They call it Tyndall effect. I don't know what is it. So all of you, please read these four physics: metachromatic nature, amyloid, why it is called amyloid in Congo red, why it is giving birefringence, apple green birefringence, gout and pseudo gout, because for example, gout is more like negatively birefringent, pseudo gout is positively birefringent. What do you mean by that? And then lastly, blue mole or blue nevus. Why it is blue? It is full of black pigment. Why it is blue? Okay, so these four physics you please read. Good, I think mast cell we covered. Mast cell in pathology, in histology, it will look like a round cell and it will have a center blue nucleus. Okay, and then the cytoplasm will be more reddish. So it will look like a fried egg appearance. That is the mast cell.
Cells of the connective tissue. Number 1, fibroblast. Number 2, plasma cells. Number 3, adipose cells. Number 4, large lymphocyte. Number 5, macrophage. Number 6, fibrocyte. Number 7, eosinophil. Number 8, neutrophil. Number 9, cells with pigmented granules. Number 10, small lymphocyte. Number 11, mast cells.
So figure 3.3. Embryonic connective tissues are stain, hematoxylin and eosin, left low magnification, right high magnification. In low magnification, first we see collagen fibers, and second they have highlighted red blood cells within the capillaries, and 3 is capillaries lined with endothelium, and 4 they have labeled the nuclei of fibroblasts. In high power, we see nuclei and cytoplasm of fibroblasts and collagen fibers.
So, see, I told you it will be spindle shaped, but here they are more round because they are tangentially cut.
Figure 3.4, loose connective tissue, white blood cells and adipose cells, stain, hematochrome and eosinophil. On the picture, first one is arteriole with a red dead cell circle, second is nuclei of fibroblasts, third eosinophil, fourth nuclei of adipose cells, fifth is adipose cells, and sixth we are saying neutrophils, seventh is lymphocytes, eighth is capillaries, and ninth one is collagen fibers.
Dense, irregular and loose, irregular connective tissue, warehouse elastin stain and Van Giessen. Is thin elastic fibers, 2 is collagen fibers, 3 nuclei of fibrocytes, 4 blood vessel, 5 nuclei of fibrocytes again, 6 collagen fibers, 7 is elastic fibers.
Only in Verhoef's elastic stain you will see it very nicely like this black color.
Dense, irregular and loose irregular connective tissue, stain H&E, high magnification. Starting from top, dense irregular connective tissue, which contains collagen fibers, nuclei of fibroblasts and capillaries. Then on the right side, there is loose irregular connective tissue, which shows eosinophils, lymphocytes, plasma cells, collagen fibers, fibroblasts, venules with blood cells and adipose cells.
The difference between dense and loose is amount of collagen. In dense connective tissue, the collagen will be more. And collagen, please remember, it is a extracellular eosinophilic material.
Dense irregular connective tissue and adipose tissue stain hematoxylin and eosin. First, dense irregular connective tissue, 2 collagen fibers, 3 fibroblasts, 4 adipose tissue, 5 is adipose cells, 6 is stratified cuboidal epithelium of excretory duct of sweat glands, 7 secretory cells of a sweat gland, 8 stratified cuboidal epithelium of excretory duct of sweat glands.
Regular connective tissue, tendon, longitudinal section, stain, hematoxylin, eosin, medium magnification. Number 1 is nuclei of the fibroblast, lateral view, then bundle of collagen fibers, stretch condition, then nuclei of the fibroblast from the surface view, then interfascicular connective tissue is marked, and on the right side, collagen fibers in bundle, 6th is fibroblast, 7th is arteriole, 8th is bundle of collagen fibers, relaxed condition.
Dense regular connective tissue, tendons, longitudinal section, stain hematoxylin and eosin. 1 collagen fiber, 2 fibroblasts, and 3 blood vessels.
3.10. Dense regular connective tissue, tendon, transverse section, stain HME. Left side is low magnification and right side is high magnification. In the left side, we see fibroblasts, interfascicular connective tissue, bundles of collagen fibers, skeletal muscle fibers, and nuclei of skeletal muscles, and finally arterioles and venules.
Super.
On the right side in high magnification, we see collagen fibers and nuclei of fibroblasts, and they have also marked Pacinian corpuscle from the low magnification.
Yeah, Pacinian corpuscle is nothing but a neural tissue with which will have a cut onion appearance. Go to the high power, all will have wavy nuclei.
Adipose tissue in the intestine, stain, hematoxylin and eosin. We are seeing arteriole, venule, connective tissue septa, adipose cells, capillaries, and we are seeing venules, fibroblasts, nuclei of adipose cells, connective tissue, and mesothelium.